like you heard from the speech.
Regulatory agencies in charge of the tobacco industry have been accused of failing in their duties and effective implementation of graphic health warnings on all tobacco products. Speaking with journalists in Abuja, Chairman Nigeria Tobacco Control Alliance, Akinbode Oluwafemi, said it is over a month now that the first set of warnings, a contract image of healthy lungs and diseased lungs of a smoker, which was issued on June 2021, expired. He added that no agency of government has implemented the provision to make the players in tobacco industry to comply with extant laws of the country. He threatened that the civil society will no longer fold hands and watch ordinary Nigerians lose their lives to the negligence of government agencies. Oluwafemi alleged that the profit-centered tobacco industry is foot-dragging to weaken the policy because it knows that graphic health warnings reduce the number of people who start smoking, just as it encourages current smokers.
In providing guidelines for effective implementation of this policy, Section 23 of the Nigerian Tobacco Control Act stipulates that graphic health warnings must be changed after an initial period no later than 24 months to new warnings and messages prescribed by the Federal Ministry of Health. You know, sometimes when you have warnings and they are just there, people get so used to them. So what the law says is that after every 24 months, there should be new ones, conveying the same messages. The law anticipated that the shock value of the warnings will begin to wane after 2 years. This is why the warnings are required to be rotated every year.
He added that the warnings can also reduce the economic burden of tobacco use by cutting the number of people who start smoking and encouraging current smokers to quit, thus lowering the cost associated with treating tobacco-related diseases. Other stakeholders at the briefing also called on the federal government to intensify the implementation of graphic health warnings on tobacco products.
And the law is very clear. It's right there. By June 23rd, 2023, you should roll out, actually before then, you should roll out these warnings. Before then. But I think, basically, as far as they're concerned, this is Nigeria. Who is going to even notice?
It's as if in Nigeria, people will say to make law is not the main thing, it's implementation. But for tobacco control, for us, our work is like watchdog to make sure that nothing is rebellious. Everything about tobacco control is holistic.
As a matter of fact, Nigeria's law is too liberal to the tobacco industry. I do not expect that they need to be reminded to implement. What we're asking them to do is what they're already doing in other parts of the world. In other parts of Africa, Senegal is just our neighbor here, it's West Africa here. And if they're able to comply with the law in those countries, they have absolutely no reason to fail to comply here in Nigeria.
The Nigeria Tobacco Control Alliance urged the Standard Organization of Nigeria, Federal Competition and Consumer Protection Commission, Nigeria Customs Service and the Federal Ministry of Health to ensure the speedy implementation of graphic health warnings on all tobacco products in Nigeria.